My name's Sarah Quilty. I'm a public health manager and I work for Nottingham City Council. So as a public health manager, I work on children and young people's agenda. The aim is to reduce health inequalities for the population group of children and young people in Nottingham City. The main areas that I work on is around policy development, around particular vulnerable areas that children are affected by within Nottingham City, so particularly children's emotional and mental health, children's domestic violence, avoidable injuries in children and young people, so preventing the children, particularly age 4 and under, attending it and being admitted through A&E. And there's a clear deprivation correlation, so children who live in deprived areas are more likely to have more accidents in the home, have poor emotional well-being, have maybe more likely to be witness to or involved in domestic violence. So it's around that advocacy around those children to make sure that the policy and interventions are developed in order to reduce those health inequalities within that population group of Nottingham. A large part of public health manager's job is around analysis of statistical information to create information that everybody understands. So it's looking at those statistics and translating them into what it really means for the population of Nottingham City. Equally, it's around gathering the information that everybody collects within a local authority and distilling that and producing it back to the local authority to say these are the real issues. So with public health, a lot of it is around gathering evidence from all different places, and we're the thread that can bring all those different interdependencies together. So we don't just look at children's social care, we would then look at children's social care, how housing is affecting the care of those children living in those houses that may not be fit for purpose. We then pull in interventions around why that might be affecting their emotional health. So then we horizon scan and make sure we bring everything together so then people can see the broader picture rather than looking at it quite silo focused. Having come from the NHS into a political environment of the local authority is around what the politicians want and what the officers want and what public health wants are sometimes three different things. So it's how public health can influence the priorities that are delivered within a local authority. An important part of the job is around influencing and being an advocate for health and public health and in my case children's health, and championing the fact that there are reasons why we need to deliver certain interventions because children's health is at a disadvantage, and we know that children go into adults. So it's around influencing decisions on how they spend their money, how we can work together in partnership better to create a better health outcome, which then impacts on their education and their future adult life. The reason why I came into this job was I'm passionate about improving the health of people, and having worked with children, working on the children's agenda and having children of my own, I am passionate about making sure that all children have a best start in life and making sure that children who may come from disadvantaged areas, we put things into place to help them have a future life. So that's the reason why I came into this job, that I'm passionate about improving health. And I think that that's if you ask anybody in public health, they want to make a difference. And I think that's why I came into this job.